Socialism and Health. Let's see what the CIA has to say about this. All sources are linked in this video's description below. All are from https://www.cia.gov/readingroom/. This was the first large-scale attempt at organizing medical service as a free public service, on the lines of national insurance. In 1900 there was one physician per 25,000 of the population and one medical station of 50 to 300 beds per 36,000 of the population. In 1913 there existed, for 80 million agricultural people, 4,367 medical stations, 4,539 feldsher stations and 49,000 beds. Though the service was far from satisfactory, it managed to create a medical organization with a network of medical stations all over the country and accustomed the people to the idea that medicine was not a trade, but a public service free to, and the right of all. The rate of death was about 30 per 1,000 and the infant mortality was 244 per 10,000 births. Organization of the medical profession, administration of public health, and status of medical sciences in the Soviet Union, page 5. The number of physicians increased by a factor of 10 between 1913 and 1953 from 20,000 to 200,000. About 24,000 doctors graduate every year, many more are still required to work the preventative and curative services of the country. Organization of the medical profession, administration of public health, and status of medical sciences in the Soviet Union, page 11 para 1-2, page 13 para 8. A high standard of hygiene among the people as a result of systematic and planned educational work, and nutritional status, contributes greatly to the success of the prophylactic and curative measures adopted by the state. The wide network of medical and prophylactic institutions made medical assistance immediately and easily available. Organization of the medical profession, administration of public health, and status of medical sciences in the Soviet Union, page 23 para 5. Malaria is eradicated in many places and in others under control. Diseases like cholera, smallpox, plague and typhus were also virtually eliminated. Organization of the medical profession, administration of public health, and status of medical sciences in the Soviet Union, page 30. Before 1917, infant mortality was about 250 per 10,000 births. This has been reduced to between 10 and 20 per 1,000 births, in 1955. Organization of the medical profession, administration of public health, and status of medical sciences in the Soviet Union. Problems of overcrowding and undernourishment have not existed in Russia for very many decades in spite of the rapidly increasing population. Organization of the medical profession, administration of public health, and status of medical sciences in the Soviet Union, page 48 para 5. American and Soviet citizens eat about the same amount of food each day, but the Soviet diet may be more nutritious. According to a CIA report released today, both nationalities may be eating too much for good health. Stank Diet 1983, Reuters 1983. Wide prophylactic measures, mass physical culture, qualified medical aid, application of the latest curative and prophylactic measures, all this has made for considerable reductions in sickness incidence and mortality. In 1953 the number of deaths registered was one-third of the 1913 figure. Today, death incidence in the USSR is lower than the United States, Britain, and France. The Soviet public health services, however, have made it their task not only to reduce sickness incidence but to eliminate completely a number of diseases with the aid of advanced methods worked out by Soviet medical science. Major success has already been achieved in this respect. An end has been put to such dangerous diseases as plague, cholera, smallpox and recurrent typhoid fever. Health protection in the Soviet Union, page 10 para 6. The Soviet budget covers all public health expenditure. In 1940 this amounted to 11,200 million rubles, in 1953 it was almost 2.5 times more, in total 27,200 million rubles. Moreover, another 22,799 million rubles were spent on health protection from state social insurance budget funds. Health protection in the Soviet Union, page 11 para 5. Despite the qualitative and organizational shortcomings of the Yugoslav health system, healthcare since World War II has improved dramatically. The death rate for the country as a whole fell from 12.7 per 1,000 in 1947 to 8.7 in 1968. Infant mortality dropped from 116 per 1,000 live births in 1953 to 59.8 per 1,000 for males and 54.3 per 1,000 for females in 1968. National Intelligence Survey 21, Yugoslavia, The Society, page 40, par 7h. The ambulatoria are state-owned and the patients are all covered by public insurance. Insurance is paid by the government and by the factory or office where the individual works, 50% by each. The individual pays nothing on his own insurance. Medical students don't pay anything for their training. They are paid 3,000 dinars per month for their living expenses, their tuition is paid for them and they receive their textbooks free. Status of medicine, medical training, research and public health, page 2, paras 1 and 4. Life expectancy at birth has been raised to 72 years, the highest in Latin America and comparable to many developed countries, and the infant mortality rate has fallen precipitously to one of the lowest in the Third World. Particularly impressive has been the eradication or reduction of diseases, polio, diphtheria and malaria, and of nutritional deficiencies. These accounted for 1/4 of Cuban mortality in the pre-revolutionary era. Although the doctor-population ratio hasn't increased because of the mass exodus of physicians in the early years of the revolution, Cuba's ratio is still one of the best in the less developed world. Cuban economy, model for Third World development? Page 20, para 2, page 19, para 5, page 19, para 4.